My name is Kelly. I'm 30 years old, and I'm having liposuction.
Right now?
Yes, right now.
Like literally right this second?
Literally right this second.
Hi, I'm Dr. Sam Sukkar. We're getting ready to go in and mark our patient, and we're going to be doing local liposuction, totally under local anesthesia.
What does that mean?
It means no general anesthesia or IV sedation. The patient is completely awake and can talk during the procedure, talk on the phone, read a book.
What's the advantage of doing it that way?
There's a multitude of advantages. Potentially it is a safer procedure because there's no general anesthesia. In addition, the patient can cooperate with us in turn, so it makes the visualization of the procedure much better, in my opinion, because we can appreciate the contours of the body as they really are. So now we're going to mark her. Let me have you turn. And this is just a topographic marking here of the areas that we're going to be suctioning to use as a road map during the surgery. Because when a patient lays down, some of this is distorted. Now, the nice thing about doing this under local is that the patient is awake, so they can actually cooperate with us, and that way we can visualize this kind of in a more normal anatomic orientation. When liposuction is performed under general anesthesia, the patient is flat, and it's very difficult to visualize this if a patient is laying on a table flat.
This is to numb the area?
This is to numb the area, the initial area. And then what I do is I inject through the area that's been numbed, and we slowly infiltrate the entire area. And we'll start off very slowly with the medicine to minimize any pinching sensation. And then as we start getting it numb, we'll increase the flow rate, and we'll show the pump that we use in just a minute.
And what's the purpose of infiltration?
The infiltration has the numbing medicine, which is in this IV bag. It's got lidocaine, which is the numbing agent. It's got epinephrine, which vasoconstricts the blood vessels and minimizes bleeding. And just so you know, this area will be very distorted. We're going to put about 1 liter of the solution into this area, so the area will look very large. And that is so that we expand the fat compartment so that it's easier to extract the fat.
How long of a procedure overall will this be?
Well, this could be 2 to 3 hours. It does take longer than if you put a patient to sleep, but I think that the benefits outweigh the length of time that's increased from general anesthesia. And you can see that she's already starting to get white where I've infiltrated in the middle there.
Is that from pressure?
That's vasoconstriction, okay, as well as from pressure.
So does this entire bag go in?
Yes, I will put the entire bag in per area that I'm doing, and we're doing 4 different areas. So we have 4 bags.
Making a grilled chicken sandwich with black beans on the side and broccoli to go with it, and a sparkling glass of iced tea.
How about some sour cream? Or some guacamole?
We're going for our endorsement from Chili's.
Oh yeah, right. Hey, that would be a good commercial for Chili's, wouldn't it? Or to sell that to them. Hey, look. I'm having lipo and I'm going to have Chili's for lunch.
Or is Outback?
We've allowed her to rest for about an hour. The swelling's gone down. She's intensely sleepy, and that's, I think, usually from the high doses of the lidocaine. So now we're going to start the extraction phase where we start to do the liposuction. So this is the power-assisted liposuction device made by Micro-Air. This is what a 3mm cannula, which is fairly small. There are some bigger ones that I will sometimes use, but even these are a little too big. And then there are some finer ones, like this. The other system that I use is from HK Surgical, which has very tiny cannulas, about the size of the 3mm. Just so you can see, and these are really considered micro cannulas. If you look over here, these are very large cannulas, and when liposuction first came about in the 80s, a lot of people use these. Unfortunately, some people still use huge, large cannulas like that, which is prone to cause contour irregularities. It allows for faster extraction of the fat, but we want a smooth result. You can see with this system there's a lot less work involved on the surgeon's part. The machine is doing most of the work, which on a long case you can have fatigue. And usually right at first you don't get a whole lot out. We're kind of creating little tunnels here. And then as we proceed, we'll start to get more and more out. And she doesn't have a huge amount that we want to remove. Just enough. So far what we're getting is pure fat. Pretty much pure fat. A little bit of fluid will be mixed in with it. But you don't see any red, which the lateral thigh is usually like this. The flank, sometimes we'll get some red areas. It's a little more vascular and fibrous. You want to suction through all of the holes. You don't want to keep going in the same direction. You minimize any contour issues. And you can see as the cannulas advance, it'll hit a fibrous area and bounce off of it. It's not sharp.
What are you listening to?
BB King.
It's not The Thrill Is Gone.
The fat is gone.
Yeah, the fat is gone.
Pure fat. Hey, we'll be done in about an hour and a half. Okay. Hey. Just have this thing stuck in my butt while I'm talking to you. Alright. Hour and a half. Alright. Love you too, bye. He's laughing. Well, I have problem areas on my thighs, on the outer thighs, and can't wear a swimsuit and panties and different kind of things without feeling insecure. So I'm having those problem areas removed. Oh my gosh.
We're done, see? A good amount. Yeah, that's probably, we'll say 1,200 pure fat. That's probably 2.5 pounds.
Wow.
Okay.
How you feel?
Good.
It's kind of amazing, isn't it?
I know.
Pretty cool.